Greetings YouTube. So I'm making a video today in regards to my nasal surgery I just had. Hopefully shed some light on the procedure, answer any questions anybody might have. This was my first time, going under the knife, so to speak, so I always appreciated doing my research, checking out other people's videos so I can kind of get an indication of what I could expect, what the procedure entailed, how people felt. So yeah, I thought I'd just share my story with you, and if you have any questions, just ask. For me, it all started about 3 years ago. I noticed that I was having a bit of difficulty breathing through my right nostril. Um, and finally, one night I just got fed up with it. So I was inundating it with water using just a neti pot and taking a Q-tip and kind of ramming up there and seeing what was going on. I don't recommend that. Please don't do that. It's not wise. In hindsight, it was a very stupid thing to do. Um, and then I just kept blowing my nose pretty aggressively for 40 minutes. And finally I just felt something shoot out of my nose. There wasn't any pain associated with it, but I definitely felt movement. Because prior to that, every time I was breathing in and out of my right nostril, I could feel something moving, and that didn't feel right. So I was wondering if I jammed something up there as a kid, and it was still there. But no, actually, when I checked it out, it was actually a polyp. I'd actually blown a polyp right out of my right nostril. Which I don't think you're supposed to be able to do on your own, but I did anyways. So I had to phone a nurse and ask if that was a part of my face I could afford to lose, or if I needed to get that reattached ASAP. Yeah, so from there, I made appointments with my family doctor to determine what was going on. At that point, he didn't have the scope necessary to actually diagnose me with nasal polyps. So what we had done is gone through the elimination process. So you want to make sure it's nothing you're allergic to. So you change your detergents for your clothing. You want to make sure that your room is dust free. You want to make sure that it's not clothes or scents. I did try a variety of different allergy medication as well as decongestants. Now the only problem with that is if you do have a chronic sinus congestion issue, using decongestants can actually make it worse at times. I found that the only medicine that had really helped me with my breathing when it came to my right nostril was Otrivin, yeah, that nasal spray. But you're not supposed to use it over a long period of time, and I was, so that was not good at all. So from there, after we got through that elimination process and we rolled everything out, I've changed everything, nothing was working. We made an appointment to go see an allergist, so that was about a 6-month wait to go see an allergist. And I'm not allergic to anything, as it turns out, so that's pretty good. From there, they just recommended that you do a saline solution wash. You can use a neti pot. They also have little squirt bottles. I recommend the squirt bottles. It's just a lot better pressure. It works fantastic. Definitely a lot better than any of the pots that are out there. Following that, went back to the doctor. He put me on some steroid spray for my nasal, and then hopefully that would just expand your passage and shrink the polyp, and it wouldn't annoy you so much. That really wasn't effective for me, so they usually put you on anywhere from 4 to 8 weeks, trying out that nasal spray, seeing is it going to work, is it not going to work. It wasn't effective for me, so we went to the next step, and he actually booked me in for a CT scan. And what the scan revealed is, in addition to polyp, I also had a deviated septum. They can't always pick up polyps, on a CT scan. In fact, I don't think mine were too terribly visible on that. I think he just mostly identified that I did have a deviated septum, and that my sinus cavities, up here, and especially those two down here, were completely full, because the polyps have been preventing drainage, which has contributed to, like fevers. It can lead to infection and whatnot. The one thing my allergist did pick up on is that I have chronic rhinitis, which is just continuous inflammation in your sinus. Polyps are random, they're not hereditary, but they generally are brought on with the onset of inflammation. For me, I was sleeping with a fan in my bedroom for 13 years, but I wasn't cleaning the fan, so there was always dust on there. So that probably contributed to constantly breathing that in all night. You get an irritated nasal passage and led to the development of polyps. So after the CT scan, I had asked, made a formal request to go see a particular ears, nose, throat specialist. Highly recommend you do your research. You always need to be your own self-advocate for health, and ask the nurses, ask your cohorts, colleagues, family members, what have you. Do your research. Some specialists are obviously better than others. Some are just terrible, and you never want to go to them. The specialist I was with was fantastic. He comes highly recommended here in the Cowichan Valley, Vancouver Island, British Columbia, Canada. Dr. Adams, absolutely fantastic. So with him, he did the same thing with me. Again, got me with the nasal spray. I knew it wasn't going to work walking into that, but you still have to entertain it. So did that for about another 4 or 5 weeks. Nasal sprays, again, it didn't work. So from there we booked a surgery date. That was today, Wednesday, May 18th, 2011. Yeah, so leading up to it, I really wasn't nervous about the slicing or dicing or cauterizing. The only thing that really bothered me was the anesthetics. I don't want to lose that control. I didn't feel comfortable with being forcibly made unconscious. But my experience at the hospital was fantastic. Walk in, I'll just take you a step by step of what you can expect. Obviously, there's going to be variations with each hospital. They have their own standards and practices. Each specialist is going to be a little bit different. So, but the fundamentals are more or less the same. So you're going to walk into emergency, you're going to register with them. They're going to ask you same set of questions that you're going to be asked about 4 or 5 times while you're at the hospital. So do you have any dental work, retainers, crowns, bridges, caps? Do you have any allergies? Do you have any pre-existing medical conditions like asthma or diabetes? Has anyone in your family had any reactions, adverse reactions to any anesthetics? Do you have any piercings? Do you have you had any procedures before? So all those types of questions, and then they'll give you a form, and you just walk over to the day surgery area. You'll drop that into a slot, that piece of paper they give you into the slot, and then an admissions nurse will eventually speak to you and ask you kind of the same set of questions, and then they will give you this lovely little wristband and whatnot. They want to ask you your identity, make sure your name's spelled right, all your contact information is up to date. Because with any surgical procedure as well, you're also going to want somebody there to drive you home. They won't permit you to do that, or at least they shouldn't if they're competent. Um, so there you wait. I waited about 2 hours in the waiting room, mostly just because I think there was an emergency C-section, so my anesthetist was actually pulled away to go and deal with that. But after 2 hours, you go into the day surgery room. They're going to weigh you. They're going to take your blood pressure. You're going to change into your gown, your surgical gown. No, you get to keep your underwear on, so you're not completely nude. They'll give you a warm blanket and whatnot. You'll just sit in the bed, and like I said, they'll take your blood pressure again. They're going to ask you some of those basic questions. From there, as soon as they're ready in the OR, they'll just wheel you near to the operating room. I just had to wait 10 minutes while they were cleaning it out. I got to meet my anesthetist. I don't know why I'm struggling with that word. Apparently I am. And he was a terrific doctor, Dr. Ritter here in the Cowichan Valley. Awesome gentleman. Again, they're going to ask you questions. If you have any concerns, ask anytime to any one of the members. They're happy to answer it. Yeah, so we'll meet to the operating room. There's a variation. Sometimes when you're waiting in the day surgery area before you go into the operating room, they can start your IV. A lot of people will ask you if you're comfortable with a student starting your IV. I'm not. Only my real reason is that this was my first medical procedure. I've never had an IV before, never been knocked unconscious, so I really didn't like the concept of a student handling that. But I was actually the anesthetist who did my own IV, and he actually didn't do it in my wrist. He just did it right here in my arm. So it was pretty fast acting. I was probably only conscious about 10 minutes in that room. They put the nitrous oxide, the mask on your face, and they ask you to take several deep breaths, and you do, and you don't remember falling asleep. A lot of people say it's a dreamless sleep. I actually did dream in mine. It was about Lady Gaga for some reason. I have no idea what that's about. But yeah, my procedure to correct my deviated septum, remove about 5 polyps or so from my right nostril, and there was a couple in my left as well. Drained my sinuses, and then they also opened up the passages to my sinuses. So for all that, it took probably about an hour. I remember being in the OR room before I went unconscious about 1:10 p.m. I remember being woken up about 2:20 p.m. No nausea, no discomfort, no dizziness. I was perfectly awake. My cognitive faculties were in perfect order. They keep you in recovery room for about a minimum of an hour. Just make sure you don't go into cardiac arrest, to make sure the paralyzing agent is coming out of your system and whatnot, and just that you're breathing okay and your blood pressure is fine. So yeah, I'm prepared to get your blood pressure taken a lot of times, and it's good that they're doing that. Just expect that. For me, I was up and ready to go right after my surgery. I don't remember anything, so that's good. Then they'll wheel you back into the day surgery area. Usually, some people take a little bit of time there. Like I said, I was good to go, no complications whatsoever. So you got dressed, and away I went. So I was out of the hospital by about 3:20, 3:30. So it was terrific. Right now, this is about my 4th dressing package that I've done there. I've bled through the other ones. The real reason being that as soon as you get home, you probably want to have something to eat or drink prior to your surgery. The day before your surgery, the hospital will phone you and tell you what time you need to come in. If you haven't heard from the hospital by 6 p.m., you actually need to phone them and ask what time is best to be coming in, when do they want you. You will also be an NPO patient, which means nothing per orally, which means no water, no food whatsoever in your system. If you have that in your system prior to your surgery, you can vomit, and you can actually aspirate that into your lungs, and that could kill you. So definitely not a good thing. So absolutely not even water. You're permitted to brush your teeth in the morning, but you can't swallow that liquid. Uh, so you will get thirsty, you will get hungry. I mean, I'm a big boy myself, so I wasn't hungry at the least, but I definitely was thirsty. So when you get home, try to eat, try to drink. My recommendation is have some soup or some liquid food. The packing will be right against your top lip, sorry. So it definitely makes eating a bit of a challenge. So if you see, you've got my coffee, I've got it with a straw here. Um, but yeah, lots of fluids, lots of eating. You may not feel like eating, but you should try to get those, the anesthetics out of your system. You're going to feel a lot better if you do. As soon as I got home, I rested for about 2 hours, kind of half sleeping, just half with my eyes closed. Um, but other than that, it was a fantastic surgery. Like I said, a lot of competent professionals, great mannerisms. Surgery went without a hitch. By 6 o'clock, 5 hours after my procedure, 4 or 5 hours after my procedure, I'm fine. I'm up, I'm walking around, I was outside, I was on the telephone. This thing on my face right here, you don't have to keep this on all the time. It just goes right around your ear. Like I said, just holds the packing right in front of your nose. Um, and just because when you are drinking and whatnot, you'll notice that every time you swallow it, it puts pressure on your nose. That kind of causes it to bleed a little bit more. But as soon as you're ready, you can take it off. You don't have to keep this on all night. I notice your ears kind of get sore. So I'll just show you what the packing looks like. Because after they've done the surgery, they will fill that baby right up with packing. This is what it kind of looks like. Now, the sutures you're seeing there are not actually in my skin. They're actually just in the packing, and I forget the actual explanation of why it's in the packing, but it's not, part of my nose. It's not a wound by any means. But if you look, you can see just the red there. That's all just the blood-soaked packing, and they go way up there. Like it's like one of those clown things, where they keep pulling the handkerchief. That's essentially what it's up. All the way up to almost to your brain, really. Tomorrow I'll go in at 7:40 in the morning, and my specialist, the ear, nose, throat doctor, will remove that packing for me. And they also send you home with these lovely little brochures, your patient information. So in here, it's going to list everything. Talk about your packing, what you should do, what you are not to do, kind of when you can resume activities, so and what you should do as a follow-up for that. Also send you home with your own bandages and your little cardboard tray, so you can be changing out your dressings. But immediately following surgery, when they first wake you up, they're going to ask, how do you feel? My nose was pretty tender, so they gave you some fentanyl while you still had your IV in. And fentanyl is just a powerful, pain drug and whatnot. So they give me a shot of that. Then they gave me some T3s. I also have a prescription for T3s, but pain is very minimal. Like I said, right now there's not a lot of discomfort. The only thing that sucks is, like I said, when you try to eat and hydrate yourself. You will be hydrated slightly when they do start the IV and get those intravenous fluids in you, but you should be drinking a lot more water, especially when you get home. But yeah, like I said, surgery is fantastic. I regret putting it off for as long as I did. So really get the ball rolling. Like I said, do your research in regards to your ears, nose, throat specialist. Dr. Adams here in the Cowichan Valley, Vancouver Valley, British Columbia, Canada. Top notch. Speak with the nurses, speak with anyone you have. If you have any questions or concerns, raise them, right? Or if ever a medical procedure is, they're telling you to do something and that strikes you as odd, or you just don't think that's right, challenge them on that. Ask them to explain why they're doing that. Any competent health professional will be more than willing to discuss that with you. They want you to be informed. They should be happy that you're asking these questions, that you're taking an active interest in your health. So just be your own advocate. Don't be afraid to ask questions. And yeah, so this is as swollen as my nose is getting, so kind of big. Like it took a good, punch to the face. But like I said, no discomfort. My recommendation is wherever you're going to sleep for that night, they generally recommend you sleep up in like a reclining position. You can do that wherever you're going to be, though, especially my bedroom. I know I went and I cleaned. I cleaned after my surgery. I should have cleaned before my surgery, just to wipe down to make sure there's no dust anywhere, because that's going to be the big thing. They recommend absolutely no feather pillows. That's probably one of the worst offenses you could do. You can buy these special duvet covers. I'm really not going to waste the money on that. They recommend no carpets in your bedroom, but again, I'm not going to tear out my carpet. I just vacuumed with a HEPA filter in my vacuum as well. I took a Swiffer duster and just went to town in this place, so it's pretty much dust free. And have those things ready to go. Like I said, when you get home, you're going to be sleepy. You're just going to want to rest, and you don't want to have to be doing anything as soon as you get home. But the surgery, like I said, really not that painful. You're up and ready to go same day. I can't wait to get this packing out and actually, take this new nose for a test drive. The polyps were blocking it so bad at times, I was forced to breathe through my mouth, and it's very uncomfortable. And let's face it, nobody likes sitting next to the mouth breather. When I'm in